Hello, my name is Mary. I'm going to be your nurse today. Today I will be giving you your insulin shot and also a, um, a vaccination, your flu vaccine. Okay. Going to perform hand hygiene and then put on my gloves. Do you have any allergies, Miss Jackson? No? Okay, I checked your chart and it stated there was no allergies, so I just wanted to double check. Okay, I checked the orders, the doctor's orders, your prescribed insulin shot, and your flu vaccination. It's time for that. Okay, so I'm using an insulin needle. And my insulin. And I'm cleaning off the top with the white first. Okay, this is for subcutaneous. And this goes in the fatty tissue, the adipose tissue, on the belly or the back of the arm, where it's fatty back here. I'm going to poke it in and draw up my fluid. I'll draw up 15 units. Okay. Okay, then you pinch up the tissue. Only if they don't have a lot of fat, you can pinch it up. If they're a little bit more, if they have a little bit more fatty tissue, you don't necessarily have to pinch, but you pinch and do a dart motion, and then insert the insulin slowly, and then you leave it in there for a few seconds, 5 to 10 seconds, and then slowly pull it out, and then dot it with hold light pressure with a clean gauze, and then you use the safety cap and put it in the sharps container. The only time you recap a needle is when you're preparing the medicine in the medication room. That's the only time you can recap and take it to the bedside. Now I will do an intramuscular. And that is going to be in the deltoid, which to find that, let me set my patient up first. It needs to be in the sitting position. Okay. You find the acromial process and go 3 fingers down from the bone. And right there's where you would give your shot. So you would clean the area from inner to outer with an alcohol pad. And this is for intramuscular, it is a 20 to 25 gauge needle. And again, use the Z-track method, which you pull the muscle taut and use a darting motion and slowly insert the vaccine. And then leave it in for 5 to 10 seconds and slowly pull out. And then you hold light pressure for a few seconds and then put a band-aid over it. Also, you can do it in the vastus lateralis, which is you count in thirds, 1, 2, 3, and 1, 2, 3. You do it in the middle, the outer middle area. So you pull that taut, do the same thing, a darting motion. And the other area for that is the ventral gluteal. And that is here. You put you find the greater trochanter, and then your thumb goes toward the spine, and then your pinky is pointing to the iliac region, and it'll be right there. That's kind of a dangerous area because you got the sciatic nerve back there, so that area is just a little more chancy if you put it in there. Then you assess the patient, make sure the patient's comfortable, make sure the patient is comfortable, make sure they have their call light, and come back in about 15 to 30 minutes and check on them and see how they're doing. And then you document what you gave, how much, what location, and again, how they tolerated it.